Hello all, I would like to talk today about a condition called retinoblastoma. So May 2nd is Retinoblastoma Awareness Day. What is this retinoblastoma? Most of you would not have heard about it. Being a pediatric oncologist myself, I would like to talk about it because awareness about retinoblastoma is extremely important. Retinoblastoma is a tumor or cancer that starts from the eye. So as most of you would have heard, eye is a small part of the brain. It's like an extension of the brain. Basically, the eye is connected to the brain by way of a nerve called optic nerve. Whenever the tumor, just like tumors can affect any other organ in the body, they can also affect the eye. Retinoblastomas are usually seen in infants, starting anywhere from a newborn infant all the way until up to the age of 2 to 3 years of age. Children can have retinoblastoma. How do you pick up retinoblastoma in a newborn? It's extremely important and vital for you to know. So being a parent, when you observe your child, you see their eyes, you see their face. When you see their face, pay special attention to their eyes. If you see that their pupils, which is the black part inside of our eyes, if it looks unequal, so both the eyes pupils are not of the same size, there is a difference in the shape or size of one pupil from the other, or if there is a white color in the place where the black pupil should be, if there is a white dot, that has to be immediately checked out by your pediatrician or by an ophthalmologist or an eye specialist. Now, why is it important? Because the pupil or the black part of the eye has to be black. If there is white dot in the place of that black circle, that means that may be a tumor inside the eye, and it has to be immediately picked up, evaluated, treated so that the child can be saved. So how common is this retinoblastoma? Fortunately for most children, retinoblastoma is not very common, and as I said, happens only in the younger age group children. If it is picked up with the diagnostic signs, as I told you, it can be treated very easily. Yes, it might involve chemotherapy, it might involve radiation, it might also sometimes in advanced cases involve removing of the eye, as in the ophthalmologist will be doing what we call enucleation, where if majority of the eye is involved by the tumor, it has to be removed surgically, after which chemotherapy or radiation therapy may have to be given. Retinoblastoma, unfortunately, in some children can involve both the eyes. So sometimes you can see a white dot in both the eyes, but don't think that that is normal. It has to still be examined by a pediatrician or by an ophthalmologist. Also, retinoblastoma can be a genetic disease where a particular genetic mutation called the RB or retinoblastoma gene can be passed on in generations. So if there is a history of retinoblastoma in any of your extended family members, make sure that you know the history of your extended family members, a few generations before you, like mother, aunt, cousins for your mom or your close cousins. If there is retinoblastoma, it is important to ensure that your child is examined and evaluated for presence of this tumor, because as I said, if it is diagnosed at the right time, picked up at the right time, it is actually a very treatable cancer in children, and it can lead to children having a good quality of life even going forward, given that it is diagnosed and treated at the right time. If you have any further questions about this deadly disease which involves the eye, please reach out to me. I'm Dr. Neema Bhat, pediatric oncologist.